Okay, now let's talk about cholinergic blocking drugs from chapter 21. So these are drugs that block or inhibit the actions of acetylcholine in the parasympathetic nervous system, also known as anticholinergic. The mechanism of action is that they are competitive antagonists. They compete with acetylcholine. They block acetylcholine at muscarinic receptors in the parasympathetic nervous system. As a result, acetylcholine is unable to bind to the receptor site and causes a cholinergic effect. Once these drugs bind to the receptors, they inhibit nerve transmission at these receptors. So the effects in the cardiovascular system include, in small doses, you'll see a decrease in heart rate. In large doses, you'll see an increase in heart rate. In the CNS system, in small doses, you'll see a decrease in muscle rigidity and tremors. In large doses, you will see drowsiness, disorientation, and hallucinations. As far as the eyes are concerned, you're going to see dilated pupils, so mydriasis. Decreased accommodation caused by paralysis of ciliary muscles, so cycloplasia is another term for that definition. GI, you'll see relaxed smooth muscle tone of the GI tract, decrease in intestinal and gastric secretions, a decrease in motility and peristalsis. In the urinary system, you'll see relaxed detrusor muscle, an increase in constriction of the internal sphincter. A result usually is urinary retention. At the glandular level of the body, you'll see a decreased bronchial secretion, saliva, and sweating. Respiratory, you're going to see decreased bronchial secretions and dilated bronchial airways. So, CNS system indications, you're going to see decreased muscle rigidity and muscle tremors. That's typically in Parkinson's disease, also in drug-induced extrapyramidal reactions. Cardiovascular, they do affect the heart's conduction system. Low doses, once again, is going to slow the heart rate. High doses block the inhibitory vagal effects on the SA and AV node pacemaker cells. So that's what causes the resulting in the increase in the heart rate. Atropine is used primarily for cardiovascular disorders. Diagnosis of sinus node dysfunction, symptomatic second-degree heart block, severe sinus bradycardia with hemodynamic compromise or advanced life support. We always use atropine with bradycardia, severe bradycardia, I should say. Respiratory system, blocking the cholinergic stimulation of the parasympathetic nervous system allows unimposed action of the sympathetic nervous system. So this results in a decrease in secretions from the nose, mouth, pharynx, and bronchi. You'll have relaxed, smooth muscles in the bronchi and the bronchioles, decreased airway resistance, and bronchodilation. GI, the parasympathetic nervous system controls gastric secretions and smooth muscles that produce gastric motility. It does serve as a blockade of the parasympathetic nervous system, which then results in decreased secretions, relaxation once again of the smooth muscle, and decreased GI motility and peristalsis. GI drugs are used to treat irritable bowel and GI hypersecretory states, so anything that's secreting more than normal. Indications for our urinary system, we're going to Be mindful of reflux, neurogenic bladder, and incontinence. What is neurogenic bladder? We will discuss on Monday and on Thursday. If you guys are unaware, just remind me, but I'm making a note now. Indications include acute pancreatitis, reduces gastric and pancreatic secretions, preoperatively reduces salivary secretion.